Hello, my name is Clayton Stocker and I'm with the UCF Physical Therapy Program. I'm going to be showing you a compression treatment for edema, specifically edema of the lower extremity due to chronic venous insufficiency. The function of this treatment is to increase venous and lymphatic circulation, reduce limb swelling, and increase the function of the limb. Before we begin treatment, I should tell you about some of the contraindications and precautions. Some of our contraindications include heart failure and pulmonary edema, acute deep vein thrombosis, obstructive venous or lymphatic return, acute skin infection in the area applying treatment, acute trauma, hyperproteinemia, arterial revascularization, and peripheral artery disease or arterial ulcers in the area. Some of our precautions include decreased sensation, uncontrolled hypertension, stroke or cerebrovascular insufficiency, cancer, or superficial peripheral nerves located in the area of treatment. This is our intermittent pneumatic compression device. For treatment time, it should be between 2 and 3 hours, so I'm going to set the total time for 120 minutes. Our inflation and deflation times should be between 80 and 100 seconds for inflation, and deflation should be between 20 and 25 seconds. It's a 1-to-3 ratio, so I'm going to set it for 90 seconds and 30 seconds for deflation time. My pressure should be between 40 and 80, and I don't have a dial on here, so I'm going to have to adjust it as treatment begins. This will be my practice patient, Kenny. I'm going to elevate his leg in order to increase the venous and lymphatic return due to gravity. Before I begin the treatment, I want to check his blood pressure and test for deep vein thrombosis. If he potentially had a deep vein thrombosis, you would see redness and swelling in his calf. I can do the Holman's test to check and make sure by dorsiflexing his foot and squeezing at the calf. If there is pain, that is a positive sign and compression should not be performed. To begin treatment, I would have my patient remove any jewelry and clothing that might be in the way. Next, I would have him lay in a position, in this case supine with legs elevated, to make treatment easily accessible. Then I would test the blood pressure for later comparison after the treatment is over, and I would take circumferential measurements of the edematous leg. In this case, I would use bony landmarks 7 inches below the ASIS, the knee joint line, and 5 inches above the lateral malleolus. Then I would take my stocking and apply it to the patient. Making sure there are no wrinkles and creases. And after the stocking is applied, I'll apply my compression device. Thank you. Again, making sure that no clothing is in the way. Once the sleeve has been applied to the patient, I would check the hose and make sure that they're connected to the correct spots. I would check my parameters that we discussed earlier in the video. And finally, I would provide the patient with a call bell in case he needed to call me. I would turn on the machine and wait the 2 hours for the duration of the treatment. 2 hours later, once the treatment is finished, I'm going to turn off the machine and remove the compression sleeve and stocking. With the sleeve and stocking removed, I'm going to check the skin and make sure there is no damage, rash, or swelling of any kind, and also retake the blood pressure and the patient's limb measurements, here, here, and here. Afterward, I would give the patient a compression garment or bandage to help maintain the reduced edema. With use of the pump, edema is maximally reduced after 3 to 4 weeks. Again, my goals are to help increase lymphatic and venous return, reduce edema in the patient, and finally help the patient have restored function.